Good afternoon, everyone. Thank you for joining us today in person and on the Facebook live stream. We definitely probably have a bigger contingent online right now than in the room today due to today's topic, which is coronavirus and COVID-19. Constantly changing, constantly being updated. We now have cases in Ohio, specifically in Cuyahoga County. So we're here today with our hot talk to discuss that. With me today, I have Bruce Hennes. He is the CEO of Hennes Communications, one of the few firms in North America focused exclusively on crisis management and crisis communications. Hennes Communications serves government agencies, corporations, manufacturers, education and healthcare institutions, as well as law firms and their clients that are on trial in the court of public opinion. We also have Karen Giffen. She is the managing partner of Giffen Kaminski. Her practice areas include employment litigation and counseling. She is also the former chair of our Thought Leadership Committee, which brings you these hot talks the second Tuesday of every month. So thank you for that, Karen. And then we were supposed to have Vice Admiral Forrest Faison III. He is the SVP of Research and Innovation and the Chief Healthcare Strategy Officer for Cleveland State University. But we found out about 15 minutes ago he has to be on a call with Governor DeWine concerning today's topic. So Eileen Guttman has graciously ran over here from Cleveland State. She is the Director of Health and Wellness Services at Cleveland State University. So I'm going to kick it off to Eileen to give us a medical update, and then our panelists will take it from there. Thank you.
All right. So everybody's seen and read a lot about the COVID-19 or the coronavirus in the news. It is not related to Corona beer. But it still is a very serious topic. It is highly contagious. I've had people ask me, well, isn't it just like the flu? And the answer is no. The death rate from the flu is 0.01%. The death rate right now, and again, every country has been testing differently. In Italy, which is now completely shut down, the death rate is about 1%. In other countries, it's between 2 and 3.5%. Yes. So when you look at let's even take the best case scenario in some countries where it's at 1%. It's still a magnitude of 0.01. So it's about 100 times as bad to 200 to 300 times as bad as far as the death rate goes. So in that respect, it is a very serious illness. It is much more contagious as well. So that's why you've seen the issues about social distancing, being at least 6 feet away from someone, washing your hands frequently and keeping them away from your face, staying home if you are ill, in today's some of today's communications, it is oral. It is also transmitted oral fecal route. So basically, in bodily fluids and when you go to the bathroom. So again, really good hand washing. I used to teach my kids, and they even have this out somewhere on YouTube, where singing happy birthday twice, so that you've got your 20 seconds of washing your hands, as opposed to just going like here's the water and you go like this and you're done. That doesn't do a whole lot. So really good hand washing, keeping your hands away from your face, social distancing, trying to avoid people who are sick or ill with anything. Now, people may ask, well, isn't it that they have to be really, really sick to have COVID-19? Yes and no. There are cases where people either have very mild symptoms or no symptoms at all, and that can transmit, so it means it's contagious at that point as well, which makes it more difficult to contain, because you can't just say, okay, all the sick people we're gonna, contain, and anybody who's not sick can go about their business. So it's like we have a fishing net to catch fish, but there are holes in our net. We cannot track everything and everybody. So like if you've read about Washington State when they did the genetic testing of the virus to see, you know, where did that come from? Was it just from the cruise ship? Where was it from? And they said, no, it's been circulating in the community for a while because they could, I don't understand all the genetics, but they could tell with some of the genetic changes that had happened that this was not the same virus that was from, you know, the infected cruise people or person. It was, you know, a little bit different. And so the likelihood is that it is, you know, circulating. The good news is that 80% of the people who will get the COVID-19 virus, you know, will not be affected terribly badly. But that still leaves 20%. And our high-risk population are those over the age of 50. I admit, as I said, to 36. I lie a lot. And anyone with, you know, chronic health conditions. Those are the individuals who are at highest risk. Healthcare providers, as you know, saw in China and then elsewhere, also have been, you know, are at a higher risk of catching the virus. And there was just a case on this morning's news, a 32-year-old man in New Jersey who is now, you know, in the hospital and quite ill with no previous any kind of medical history, you know, has the virus. Currently, we are testing those individuals who meet certain criteria in the state of Ohio. It is not yet, we don't yet have the capacity to test everyone who wants a test that's ordered by a doctor. We do not yet have that capacity. When we do have that capacity, you will see the numbers of cases rise exponentially. That does not mean that the outbreak has necessarily gotten worse. It just means we're testing more people. So if we're looking for things, you know, we're more likely to find it. So like if you take a legal document and you say, you know, here it is, it's done, and you don't look for any mistakes in it, you're not going to find any mistakes. But if you take that document and you start looking for mistakes, be it, you know, grammar or legal or, you know, whatever else, yes, you're going to find some mistakes. So that's the analogy to when we start doing more testing, we will find more cases because we're looking for them. Our net will have fewer holes in it. I think that's about all I wanted to say, and I know I'll be opened up for questions later, correct? Okay.
Thank you very much, Eileen. I appreciate that, and so happy that there's somebody here who can answer the medical questions, because I certainly cannot do that. My goal here is to talk about some of the real-world consequences of COVID-19 and its impact on our communities. Much of what I've read in the news is about what large governments have done, so shutting off all transportation in Italy, et cetera, and that seems less applicable to me, to my clients, to my own circumstances. And one question that pops up is, so what does the United States government or what does the state of Ohio have the authority to do in circumstances involving this kind of a public health emergency? And the quick answer to the question is a whole lot. They have authority to do a whole lot. And we can go into the details. I don't want to spend a lot of time on it other than to say there is a lot of authority to support action by both the federal government and the state government. As a general matter, the federal government has the authority that's almost absolute, not actually absolute, but significant power to deal with border security and to attempt to prevent the infectious agent from entering the United States. And we've already seen that with the president's declaration with respect to travel from certain countries. Generally, under the Constitution, public health is a matter for state governments, and as we know, yesterday, Governor DeWine declared a state of emergency in Ohio, even though there are, at least as far as we know at the moment, 3 cases and likely to be more that are as yet untested. But those two entities, the federal government and the state government, have a tremendous amount of power to regulate our conduct in the circumstances of a public health emergency. Most of the federal government's power comes from something called the Public Health Services Act, and that empowers most of what the government can do, including moving money around in the federal budget, and amassing the public health and medical response to COVID-19 or any other public health emergency. So for purposes of quarantine, the federal government generally initiates all of the quarantines related to border security. So just was mentioned, the cruise lines entering back into the United States, that's generally going to be the federal government. The state government, and there is an Ohio statutory scheme that permits the state to quarantine individuals under state law. And if there are other questions about the government's authority, we can get into it, but I want to talk more about circumstances where I have gotten lots of questions from people I know and from clients about what does it mean for me. The number one question I've got is what happens in my place of employment in connection with COVID-19. So what does an employer do if an employee is exhibiting symptoms of COVID-19 or has otherwise tested positive for COVID-19? And I want to reiterate what Eileen said. At the moment, there aren't sufficient tests to determine that question conclusively, but we expect that to change shortly. And the answer to the question is generally an employer is going to be permitted to send the employee home if the employee is suspected of symptoms of COVID-19 or a confirmed test. But it cannot be done arbitrarily. There really, in fact, needs to be symptoms of the illness present before the employer takes that action. I've had a specific question from a client on the order of, are we permitted to take the temperature of employees? We've all seen the videos of people in airports with the infrared digital thermometer taking temperatures. And the answer to that question right now is probably not. The reason for that is taking someone's temperature is a medical examination, and the Americans with Disabilities Act would generally prevent an employer from doing so unless there are specific circumstances that would warrant that. One thing that we know for sure, however, and the EEOC has guidelines. There are a lot of guidelines out there with respect to this. The EEOC has already issued guidelines to prepare workplaces for the pandemic flu, but they're likely to be applicable in COVID-19 circumstances as well. If a general pandemic is declared by any of the government agencies that we've been talking about, it may then be possible for an employer to do temperature testing of employees. The one issue that all employers should take into consideration is how they do it. Oral and anal temperature taking is probably going to be deemed not appropriate because it's a very invasive medical examination. And while I understand, and perhaps Eileen can talk more about this, that the digital scans are not as accurate. Thank you. Accurate as other forms. It is the least invasive. The other important thing to know for employers is the fact that an employee has a temperature does not mean they have COVID-19. And the fact that an employee does not have a temperature, meaning a fever, does not mean the employee doesn't have COVID-19. So I really want to say I am not sure that this is a valuable mechanism of trying to protect the workplace, at least at this point. How do you tell if someone is infected? I would again defer to Eileen on that, but there's a fair amount of information out on what's the characteristics of COVID-19. So what happens if we've actually got somebody who has tested positive for COVID-19? Does an employer have an obligation to report to either to CDC or public health officials? Quick answer is probably not, but you should know that that employee, if they seek any medical attention, that person's going to report. I frankly think it's a good idea to do so. If you have somebody who has tested positive for COVID-19, we do not recommend that your obligation stops by simply sending that employee home. It's then important before at some point to go through with the employee of their contact with other employees within a 3 to 6 foot area of that employee, and then take steps to determine whether you have to expand the number of persons who should not be in the workplace any longer. But those are important steps to take. Some of my clients have said to me, this is going to be pretty expensive. And while I think that's true, this is going to be, or this could be, I don't want to suggest that it'll actually get to this standpoint, it could be very expensive, but much less expensive than having an entire workforce become infected with COVID-19 so that all work stops. So that's the advice I've given to try to take that in consideration. So now, what happens when an employee says, I'm not going to come to work because I'm afraid of becoming infected with COVID-19? What is the employee's options? What's the employer's options? The Occupational Safety and Health Administration, OSHA, Section 13A, has a pretty clear definition of when an employee is entitled to say, no, I'm too scared because I'm afraid of becoming ill. It is an extremely high standard. In fact, it's imminent danger. Anybody reasonably expected to cause death or serious physical harm immediately. So the standard for refusal to work under OSHA is really, really high and would be hard for an individual employee to make in the circumstances as they currently exist. Again, if we get to pandemic that exists in the US, this advice might change. The other thing to remember, though, is Section 7 of the National Labor Relations Act protects employees who take collective action, and that may come into play to protect employees who collectively refuse to work. Anybody who has a union agreement or other collective bargaining relationship, my recommendation is to be talking with the collective bargaining representative now in the event that this impacts the workforce, so that you're not in a hurry up and deal with it situation later on. What about an employee who says, I don't want to go to work without a mask? What about that? I'll leave it to Eileen to discuss the effectiveness or lack thereof of masks. But as a general matter, OSHA has answers to these questions as well. There is a specific section of OSHA that addresses when an employer is required to provide, and an employee is permitted to demand to wear a mask in the workplace. They're also pretty high. So at least at this moment, I would say the circumstances don't exist that would make that mandatory, but again, it might change. There are all kinds of issues that we don't have time to go through about travel and workforce and what the president's pronounces have been with respect to that. There are new and changing issues with respect to what happens if you employ foreign nationals or persons who are currently outside the United States. One issue I want to talk about is remote work. Should an employer consider that? Quick answer to that question is yes, at least consider it and think about whether that's something that your particular workplace could handle and whether it's appropriate. Again, this is dependent upon what happens later with the disease. The last important area that I want to talk about with respect to workforce issues is what happens with this question. Is it mandated that an employee be paid if the employer says, we are going to shut down for a while? And in that circumstance, does an employer have to pay the employees? Quick answer is no. Neither the federal statutes nor Ohio statutes would require that. The Fair Labor Standards Act does not require paying employees during periods of the employee being sick or what would be termed a furlough. Ohio doesn't require that either. Are employees covered by the Family Medical Leave Act in these circumstances? Quick answer is maybe if the employee has contracted COVID-19, but not for employees who have not contracted COVID-19, and even in circumstances where the employee has contracted the illness, only in circumstances where they otherwise meet the standards of the Family Medical Leave Act. And as we know, that act does not require an employer to pay employees. The last thing I want to touch on isn't about employer-employer relations, but in my research, I thought this was important from the business community and for all of this, is there are a lot of ways that this may impact our other business relationships. For example, any employer that has contracts that has a force majeure clause, meaning that for some reason, some portion of the agreement cannot be fulfilled because employees are not there, supply chains have been disrupted, et cetera. In those circumstances, there is no one answer. You have to look to the specifics of the force majeure clause to find out whether it's going to apply in your circumstances. There are general common law principles about impracticality of performance that may be applicable here, but again, there's not going to be one answer. Other than what's going to happen at my workplace with COVID-19, the second most common question I've been asked is my travel and what happens with my travel insurance. There is no one answer there either. Travel insurance policies are remarkably dissimilar from one another. So reading the terms of your policy are crucial to determining what would happen. The one thing that I know for sure that I can tell you of, the travel insurance industry has declared that as of March 4th, any travel insurance policy will be given under the assumption that that individual knows of the risks of COVID-19, and therefore any impact on travel relating to COVID-19 is not covered. So after, we're too late to buy any travel insurance for the foreseeable future. Until the COVID-19 crisis is over, you can't buy travel insurance for wherever it is you want to go. Anything prior to that, any policy prior to that point, you have to pay attention to the terms of the policy. I could go on and on and on, but I'm sure that I am outside my 10 minutes.
That's okay. You were very interesting. And I'm happy to cede some of my time. Well, as was mentioned earlier, I'm in the crisis management and communications business, and I'm going to tell you exactly what I am telling my clients right now. I'm telling them that we absolutely and fully expect this virus to go pandemic, but even a mild pandemic results in a large number of deaths. Certainly, it will be disruptive with hospital overcrowding, absenteeism, and supply chain problems. At some point, you are all going to have what we call in our business an oh my God moment. And the oh my God moment is when you realize that this is a real crisis and this is not just a bad flu season. And the goal for people in my business is to help as many of you, many of our clients, have that adjustment reaction before the crisis is full blown so that you are ready to cope resiliently with what's coming. All right, what's coming is really, really bad. All right, and with that in mind, my short presentation is focused on what we call business continuity, which is staying in business in the face of massive disruption. Let me pull this. Skip that one. Okay. Is that slide number 3? There we go. Okay. Well, using peacetime wisely, we believe that once there are enough clusters of illness, there will be a tipping point where social distancing will be mandated. And what that means is schools will close, malls will close, restaurants will close, stores, sports venues, and movie theaters. We do believe this is coming, and you need to use peacetime wisely. Once it's obvious that you should do something, it will also be obvious in hindsight to you and everyone else that you should have done it sooner. All right? The rule of thumb, consider doing now what you already suspect you will need to do soon, or resign yourself later for being blamed later for not having done it sooner. Vis-a-vis overreacting versus underreacting, you're not damned if you do and damned if you don't. You're damned if you underreact, and you're darned if you overreact. I mean, I would love it if 6 months from now you call me on the phone and say, you told us that, they were closing everything, it didn't happen, that the water was going to, stop flowing, and it didn't. I would love to be wrong on something like this, but I don't think I am. Let's go to number 4. But business continuity planning, all right? To do business continuity planning, we start with putting the right people in the room. Again, I'm talking to you not only as individuals with families, but I'm also talking to the audience, of people here who, of lawyers and people who run law firms, because that's why we're here today. When we do something called a vulnerability audit, and that's where we put all the right people in the room, the practice leaders, the managing partners, IT, HR, marketing, et cetera, and we play what if. I mean, what if, and we look at all the different possible scenarios, and no scenario is too outlandish. Just some examples. What if a client walks in for a meeting and they're coughing and sneezing? What do you do, and what do you say? What if a lawyer gets back from a meeting in Columbus and tells you that she just found out that someone at the meeting is now under quarantine? What do you do, and what do you say? What if an employee becomes ill during the workday? By contemplating these situations and pre-preparing messages that address each of these scenarios, I mean, you're not going to have hours or days to respond. This is not a time for lawyers to be thoughtful and to come back a day or two later after they've done research. There is not going to be time. Your different stakeholders, your employees, your clients, your families, they are going to demand answers, and the window is going to be very, very short. And make sure that those responses are written in plain language, not legalese. All right. Review all aspects of your plan. Make sure you've got a staffing plan, a communication strategy, if there's training to be done, policy, systems for clearing and approving information. We suggest that our clients assess and update the availability of their technology and equipment, such as mobile phones, computers. Are your people at home going to have the right kind of internet access and wireless devices? Is everything ready to go at a moment's notice? Because I don't think we're going to have a whole lot of notice. I mean, there wasn't notice in Tokyo when they closed the schools, and I don't think there was a whole lot of notice for the business community in Italy that they were to close things down. For those of you in business at offices that have VoIP phones, I found out something very interesting. That means that your phones are managed in the cloud. You can actually take a VoIP phone and take it home, and it works the same as if you're sitting at your office. I did not know that till yesterday. What's your paid sick leave policy for people who feel ill or whose kids are home because their school is closed? Client communications. You should make sure that you're providing a constant stream of information to your clients, to let them know that you're taking care of business and what the steps are doing to ensure quality. Getting ready for pandemic. Did I skip that one there? All right. I think I was a screen behind. Getting ready for a pandemic is also about preparing for possible shortages. All right. You should encourage your employees to use peacetime, again, wisely. And right now, people ought to have 2 to 4 weeks worth of food and medications on hand. All right. Once again, I'd much rather you say to me, we have all these canned goods, we never needed to use them. But the problem is, once people have the oh my God moment, all right, they're going to freak out. All right, and they're going to run to the grocery stores, and whatever's left, they're going to take out. But this is not like a hurricane. I was talking to my brother down in Florida. I said, when the hurricanes hit, all the suppliers, all right, the big box retailers, they know it's coming, they know where it's coming, they know days in advance, and they begin to amass stockpiles that are, if it's coming to Florida, they put stockpiles of these things days in advance in Alabama and Louisiana, and then they can rush all that stuff in as soon as the hurricane passes. That's not what's going to happen in this case. Right? The stores nationally are going to be stripped bare of materials and goods, and it may take weeks before they are resupplied. And even when they are resupplied, all right, there's going to be a lot of things that are missing because a lot of the things that we count on seas. All right, so again, I'm not suggesting you go out. I'm not suggesting you be a prepper and have an air raid shelter and enough food and water for 6 months. But especially if you have children, you're going to want to put away 2 to 4 weeks worth of goods, including medications as well. A lot of our medications, Eileen, you know better than I do, the raw goods come from
China.
Come from China. Not worried about an infection over there. I'm not worried that the goods they send over here are going to have some kind of infection. I'm not worried about that at all. I'm worried they're just not going to get here at all. A little closer, all right. HR concerns. It is conceivable that 40% of your staff is likely to be absent at any time. So cross-training is of paramount importance. All right, and past disasters have shown us that employees are more likely to show up for work if they know their family is safe, if their employer is candid about the situation, and if they have a pandemic-specific job assignment in addition to their regular routine assignments. All right, certainly you're going to want to consider relaxing attendance policies to account for employees' own illnesses or that of their immediate family members. Travel plans, I think you know what's coming here. Most companies right now are just saying no travel whatsoever. If you have a telework or a remote work policy, now's the time to make sure it's up to date. And if you don't have one, it's time to draft that policy right now. I know a good attorney that would help you do that, by the way. And it's also time for all of us to start modeling good behavior. I was out a couple of nights ago and people were, still hugging and, the Cleveland air kisses and the shaking hands. And, I was like the only one in the room going, arm bump, arm bump. All right, well, that really needs to change as quickly as possible because, again, you know better than I do. This stuff is really transmissible.
Really contagious.
Really, really contagious. So we need to alter our patterns. We need to be very conscious, very mindful about what we do. Protecting your building. All right. Consider adding more robust language to your entrance signs, such as warning signs in bold letters asking visitors having flu or respiratory symptoms to temporarily refrain from visiting the facility, even if they don't have a travel history. I'm starting to wrap up here with this. I want to talk for just a couple of moments about social media and information sharing. If you see stories about the coronavirus that seem extreme, that look suspicious, or come from an unfamiliar source, take the time to evaluate the source of that information before you hit share, all right, or you buy into it. All right, Facebook is not a reliable place for information. All right, the advice that you get from TV pundits on television, all right, must be taken with a grain of salt. You must also be aware that there really are people out there who are trying to cause chaos with false and misleading social posts. It is the Russians, but it's not just the Russians. There are just people who are sitting either at home because they have, for whatever reason, or it is an organized opportunity to sow, for some of the political parties to sow discord. They are purposely placing things on the internet that are absolutely not true. To me, the best place for accurate information is the Centers for Disease Control and Prevention, the National Institute of Allergy and Infectious Disease, your state and your local boards of health. All right, check their websites, go to their websites. Facebook also has a resource page on how to spot fake news reports or posts that are circulating on the internet. Some of its tips include being careful to evaluate headlines that look extreme or have lots of exclamation points. Check for tampered dates. check for images that just kind of look like they're altered, and then try to cross-verify the news with several other major news outlets. Now, we can discuss the veracity of the New York Times and the Wall Street Journal all we want. My attitude is, if I don't see it in the Wall Street Journal online or in print the next day, or the Wall Street Journal, I'm not going to send it out to anybody, because while those newspapers are not immune from making mistakes, I mean, everybody makes mistakes, they are very well known for when they do make mistakes, they correct those mistakes, and they correct them in real time, and they correct them very, very quickly. Another fact-checking good resource is Snopes.com, which has been providing routine updates on some of the more fanciful claims. You know, it's worth checking out. If a claim seems to be too good to be true, go to Snopes and check it out. And lastly, I want to say about the White House, and what I'm about to say is not meant to be political in any way, shape, or form. If you see information coming from the White House, pay no attention to it. The President and his advisors are doing things and saying things that not only are patently untrue, but they are literally violating every tenet of what we call risk communications, all right, where you don't want to over-assure people. You want people to take action. You want people to have factual information. This is not about politics. It's not about feel-good times.
No.
It's about making sure that you get your information from sources that are trustable and verifiable. This is now time to listen to the scientists. This is time to listen to the people who have the facts at hand, all right? Again, I'm not making a political statement. This is a statement of reality. So I've got one more thing I want to say before we're all done. I'll say that right at the very end, but it's time to open the floor for questions.
Who's got a question?
If you'll wait till the microphone gets to you, because that way the audience at home and on on Facebook can hear us.
I'll share germs on the same microphone.
Yeah.
Well,
Sorry, guys.
you should all have little bottles
Of hand sanitizer.
hand sanitizer so that you can do that afterwards.
60%
Yes,
alcohol
Ashley.
or more.
Correct.
Thank you. I'm curious, and I don't know if you know the answer to this, maybe Eileen, but how soon should we expect the sorts of things that Bruce is referencing in terms of a pandemic? And if things were, and I get that there aren't clear answers, but if things were shut down, is there any estimation on how long that would be?
I have no estimation on that. I agree with Bruce. I would plan now. I would have planned last week, the week before, starting in January. Just there's no way to know. The one thing that I keep coming back to is knowing history, and going back to the Spanish flu of 1918. Those cities that closed down early had, so basically they shut. They did the, quarantine. They shut their schools, their universities, workplaces, and that's where we're all kind of struggling. When do we call it? They had the lowest death rates. That's not zero. But they had because they stopped the chain of transmission. It's like that, I'm dating myself, that shampoo commercial, I told two friends and they told two friends and they told two friends, and it just keeps, growing exponentially. So we're trying to have people not telling their friends. And so that's going to be the $64 million question. All the health departments are working together. And the CDC. This is a brand new virus. We are still studying and learning about it, which is why we're all kind of struggling with it.
I mean, the fact of the matter is, there were opportunities over the last 2 or 3 or 4 years to stockpile more goods, respirators, N95 face masks. That was not done. The money was not spent. There were opportunities to work on testing, looking for new ways to test for these things and creating these test kits. That was not done. I can't speak to the reason for that, but without statistics, people like you can't make those prognostications that you're looking for.
I just wanted to add one more thing in reference to the Spanish flu in 1918, 1919. I think the best example is Philadelphia went ahead and had a Liberty Bond parade after it was known that the disease was infectious and in the area, and it became known as the crowd disease, at least locally, because it really exploded after that. And one of the things as employers and employees that we need to think about is when we get to that stage, areas where we work, where there's a lot of people, where we go to school, there's a lot of people, it's very similar effect to going to a parade in those circumstances, and it's something to think about and add to the cost-benefit analysis.
Yes, I'm not sure how to really word my question, but I just want to know my thoughts are about school-age children. What are some safety precautions or things we should do with those people? Because they are always tricky and they are always coughing and things of that sort. So what are some things we could do, or pulling them out of school just in general?
Well, I think the schools will close first because we love our little children, but they are petri dishes. And they are. Everybody always used to say, "Oh, Eileen, don't you catch everything from your patients?" And I'd say, "No, I catch it from my family, my children. Because my patients, I'm really good about washing my hands, and what I touch and whatnot. But my children are not so good with that, especially really young children. So the best thing that you can do is, keep your children home if they're sick. Wash your hands frequently, avoid touching your face. And also, there's a list of approved cleaning materials. So clean the high-touch areas in your home or apartment frequently. So what we're trying to do is cut down, the germs that you are exposed to. If you are sick, don't go into work. And that's really, having lived through the H1N1 pandemic, so many of our patients, both employees and students, come in when they're sick. We had told them, please call first. And, because again, going through the H1N1 pandemic, we did not know how bad it was or wasn't going to be. With a flu pandemic, you basically look back and then you can tell how bad it is. So they'd call up and we'd say, okay, fine, what symptoms? Yes, yes, yes. Okay, you probably have H1N1. Where are you? I'm in class. And messaging had gone out about if you're sick, stay home. So I think that, that I can't emphasize that enough because, we have to have the policies in place so that people feel comfortable enough, and the financial thing, I don't know how because I can't print money, but, so that people are comfortable enough staying home when they're sick so that they don't transmit it. If they, say they have a mild case of the coronavirus that we're not testing for, but if they stay home, they're not sharing it with everybody, and little kids, yes, little kids can catch it. They seem to, at least from the data coming out of China, which we have to take with a little bit of a grain of salt, seems to be that they don't get very sick, with it, which is to me, it's a thank God thing, because usually when it's an influenza thing, it's the very young and the very old. So thank God on that, response. But basically washing your hands, cleaning stuff, and with other children trying to stay further away, if it's in your own family, that's clearly, much harder. My daughter right now, her 2 kids are quarantined in New York. And so she's home with her, 2 kids, and, we just go like this, making sure, hopefully, that they don't get sick. It's hard. You're welcome.
Anybody else? Michael?
I'll let you hold it.
Yeah. Let her hold it.
This
Let
is a
her
lot
hold
easier.
the microphone.
So given the talk about isolating towns and shutting down towns, they made a lot today that China was able to do that because of its politics and its authoritarian regime. They had the power to close Wuhan right away, and now the Prime Minister went back and said, because we were able to do this, we've stopped the spread. What would it take for that to happen here? And the converse is, if we're not getting signals from the White House, back to Bruce's point, that we need that, but the scientists think that it's needed, are there methods states or other municipalities can do to protect themselves if the government doesn't?
I'll take that, and then the Article 1 of the Constitution that addresses congressional powers doesn't discuss public health as a matter for Congress to regulate. It does say Congress can regulate interstate commerce. It does say that Congress and the executive can maintain the borders. So we know for sure that the federal government has the power to do all of the things they've already done with respect to the borders. If the federal government wants to attempt to regulate, quarantine, et cetera, inside the states or interstate, they have a much higher burden. They have to I should say that this is the existing state of the law. Who knows if that's what it's going to be when it comes to it. They have to establish that the individuals they're attempting to detain, there is a reasonable belief that they are in a qualifying state, which I assume the courts will interpret as capable of transmitting the infection. So that's a much higher standard and wouldn't apply to the broad shutdown of large portions of the United States inside the United States. However, each state has very broad authority to do just that. So we could end up in a situation where something happens in Ohio differently than it happens in Montana or New York. And then I can see the federal government stepping in, because that would have an impact on interstate transmission of the disease. But I don't think we yet know the precise answer to that question.
I'll tell you when I think things will shut down. As soon as you have a couple more members of Congress come down with COVID-19, as soon as you have a couple of them unfortunately pass away from that, or other politicians at the state level, all of a sudden that's going to change the tone of the debate quite a bit. It'll also change when the state and the county directors of health, or what are their titles? The
Public health officials.
Public health officials. Yeah.
Frankly, when they get the courage to go to the politicians and say, I have the authority to close things down, and I am going to do just that. All right, because they do have that authority. What they don't seem to have right now is the courage to do that.
Italy is, I think, a pretty good example of this. With a liberal democracy, generally speaking, probably not as much as ours. But they have effective a complete travel ban, and they haven't done that since World War II. So, I mean, it can happen, and I agree with Bruce. I don't know if it will be necessary here, or if our politicians will take those steps.
I think you may see certain cities taking that action first.
Yeah.
And how would a city get to that? You would have sustained person-to-person, transmission, not like somebody was on a cruise on the Nile and came back to Cuyahoga County and tested positive. But the fact that, they told two friends who told two friends who told, so that there's sustained transmission in the community. I don't know what number of cases the city health department would need to see, or the county health department would need to see, to just say, oh, okay, now we're going to close down. I know that at a certain point, and I'm not even sure for me what that point would be yet, because it will depend on a whole lot of factors, that I also would be jumping up and down, saying, okay, we really need to break this chain. We need to close down things.
I didn't touch on, there is a real question. Let's say a business decides to stay open and mandate employee presence and brings in customers at a point at which everything else has closed down around that business. That is a circumstance where I would be recommending, if that business was my client, don't stay open unless you're able to do a dramatic justification to protect employees and your customers, because you can imagine the potential for litigation following the end of the crisis of having made that decision, in addition to the public relations potential should there be deaths that follow staying open.
I have a couple of questions from participants from our Facebook live stream. And the first one is a health-related question. How do we differentiate between common cold / fever type symptoms and COVID-19?
That is the $64 million question. Right now in the state of Ohio, what they are testing, it has to meet certain criteria because of the dearth of testing. Supplies and sites and protective equipment, and just keep going. So you have to have a fever, you have to have trouble breathing, possibly exposure somewhere along the line, and hopefully those criteria will loosen up, because that is the big question. And we don't know right now, because they're coronaviruses, and a cold, I mean, they're cousins, they're related. I don't know if it's through the mom or the dad, but they're related. And so we really need that testing capability that we don't have yet fully.
Okay.
I didn't answer it well, but that's the answer.
Well, second question, also, I'm not sure there is a firm answer on this, but it says, is the mail safe? Are we at risk if we receive mail at our office if we otherwise close the office to visitors or guests?
How long does it stay on surface?
Well, the virus can live for hours and or days on hard surfaces. But like, for instance, I know that they were saying shipments of goods from China to the U.S., that was not an issue of it being contagious that way. So I would have to say that the risk is very small. If you are concerned about it after you handle the mail, then go wash your hands with soap and water is better than that. If you have nothing else available, then do that. But why is soap and water better? Because of the
Abrasion.
well, and the soap breaks down the fatty, outer layers of the virus, blah blah blah, and then also the mechanical abrasion, and then also wiping it with a paper towel is actually even better than putting it under the blow dryer. But again, everything, something is better than nothing. So the hand sanitizer, kills a lot with the alcohol, but the best is hand washing. So that would be my, suggestion for the mail.
Do we have further questions? We have time for one more.
No? Yeah, I just want to say in closing, I know I'm certainly the fly in the ointment here. I'm the Cassandra here. I desperately want to be wrong. I desperately want us to get through this. I want our economy to be better. But, when you really dig below the surface and you listen to what the scientists are saying, when you look at what they're allowed to say and what they seem to be not allowed to say, the messages are fairly dire. Again, as crisis managers, our job is to prepare for the worst and hope for the best. And that's what we want our clients to do. It's what we want our friends and our families to do. And then to go, aha, I told you so, it wasn't so bad later. That nothing would be better than that. So I think that's it. Should we go ahead and wrap it up? Do you want to do the honors of?
Yeah. Thank you, everyone, for being here today. Thank you to thank you, everyone, for coming today. We will potentially have another hot talk in April, but it might only be on Facebook Live, so stay tuned. Thanks, everyone, for coming and being on the live stream.